Today, we are going to discuss about the association between the number of academic research consortium for high bleeding risk, that is ARC-HBR criteria, and clinical outcomes in patients with acute coronary syndrome. Academic research consortium for high bleeding risk, that is ARC-HBR criteria, have been used to identify high-risk patients undergoing percutaneous coronary intervention in current clinical practice. The objective of this study is to evaluate the association between the number of ARC-HBR criteria and clinical outcomes in patients with acute coronary syndrome after an emergent percutaneous coronary intervention. A total of 338 consecutive patients with acute coronary syndrome who underwent successful emergent percutaneous coronary intervention were assessed. The ARC-HBR score was calculated by assigning 1 point to each major criterion and 0.5 points to each minor criterion. The patients were classified into low, intermediate, and high bleeding risk groups. The association between the ARC-HBR score and major adverse cardiovascular events were investigated, defined as a composite of all-cause death, non-fatal myocardial infarction, and non-fatal stroke. The diagnostic ability of the ARC-HBR score and controlled Abciximab and device investigation and lower rate angiographic complications risk score was also compared. Coming to the results of the study, 70 patients developed major adverse cardiovascular events. The cumulative incidence of major adverse cardiovascular events was significantly higher as the ARC-HBR score increased in a stepwise manner. There were no significant differences in the area under the receiver operating characteristic curve for predicting major adverse cardiovascular events within 2 years after an emergent PCI between the ARC-HBR and CADILLAC risk scores. Coming to the conclusion of the study, ARC-HBR score was independently associated with an increased risk of major adverse cardiovascular events in patients with ACS after an emergent percutaneous coronary intervention. Moreover, it had a similar diagnostic ability for predicting major adverse cardiovascular events within 2 years compared to the CADILLAC risk score.